with the high cholesterol, we have this can lead to atherosclerosis, which can which affect the artery supplying the brain. So this can result in what we call ischemic stroke, and if a blood clot blocks an artery, that's what you develop ischemic. Hello guys, welcome to our channel. The channel is Nazvin. Today we are going to talk about the 12 signs of excess cholesterol. 12 signs of excess cholesterol. We're going to talk about how one presents, the management over the same, or the treatment for that excess cholesterol. We're going to talk about the complications and how to manage them, prevention, and we're going to do a summary over the same. So guys, welcome. The channel is Nazvin, and kindly, if you have not subscribed, I want to encourage you to subscribe, because that is the best way in which you can always support us. So when we talk about excess cholesterol, particularly it results from when we have a high level of low density lipoprotein. That's all what we call LDL. So cholesterol. So this can lead to several issues, and I'm going to give you 12 signs and symptoms that may indicate that you have this excess cholesterol. So guys, number one is about chest pain, what you call angina. Angina is one of the signs for this excess cholesterol. When we talk about angina, we're talking about excess cholesterol in the body, and that is what you call this can occur when one develops discomfort or pain, especially during the physical activity. This can be a sign of reduced blood flow to the heart due to clogged arteries. Number two is about what we call exanthelazima. And when we talk about this, I'm talking about XANTHE Cathelacima. So this is a yellowish deposit of cholesterol underneath the skin, typically around the earlids. So you may have, and when we talk about earlids, we'll talk about this part of our body. So we may have a yellowish deposit of cholesterol underneath the skin, especially the earlids. That's a sign of excess cholesterol. Number three is about what you call xanthomas, XANTHOMAS, xanthomas. So these are fatty deposits that develop under the skin, often appearing as yellowish lumps on the elbows. Elbows is here. We have these fatty deposits on the elbows. We also have on the tendons, and also knees, hands, or feet. So yellowish lumps on the elbows, where we have the joints, where we have the tendons, where we have the knees, and also hands and feet. Number four is about corneal arcus. Arcus is ARCUS. These are a grayish-white ring around the cornea of the eye, so which can be a sign of high cholesterol, especially in young individuals. Where we have corneal arcus, where we have a grayish-white ring around the cornea of the eye, and can be as a result a sign of high cholesterol, especially in young individuals. Also, we have high blood pressure as a sign. Elevated blood pressure can result in the narrowing or blocked of arteries, a common consequence of high cholesterol levels. Number six is about the shortness of breath. When we talk about shortness of breath, we mean there's an issue with when we talk about high cholesterol levels. We are talking about high blood pressure as a consequence of narrowing or blocked arteries, where now we have as a common consequence of high level of cholesterol. Number six is about the shortness of breath. When we talk about shortness of breath, we are talking about difficulty in breathing, particularly during the physical activity that can occur if high cholesterol has caused coronary artery disease or other cardiovascular or issues. Number 7 is about fatigue. Persistent tiredness or fatigue may result of reduced oxygen supply to the heart due to the narrowing of the arteries. Number 8 is numbness or tinkling in the extremities. Reduced blood flow to the extremities. When we talk about the extremities, we're talking about the hands, the legs. So the parts of the legs, we may have numbness or tinkling, where you feel tinkling sensation on the hands and also the feet. So it can be a sign of clogged arteries that cause numbness and tinkling sensation on the hands and the feet. Number 9 is about dizziness and also lightheadedness, where occasional dizziness or lightheadedness where may occur if the blood flow is affected to the brain. So because of the reduction of the blood to the brain, we may have lightheadedness or dizziness coming up. Number 11, we may have stroke symptoms, where we may have a sudden numbness or weakness in the face, arm, or leg, especially in one side of the body, where now confusion, trouble speaking, or difficulty in walking can be signs of a stroke, which can be related to high cholesterol. Also, we have swollen feet, where swelling in the legs or feet may be a symptom of peripheral artery disease, which is associated with the high cholesterol levels. And last but not least, we may have heart attack symptoms, where sudden numbness or weakness in the face, arm, or leg, especially in one side of the body, confusion, trouble in speaking, or difficulty in walking can be signs of can develop, where one now especially have a lot of symptoms such as chest pain, discomfort, pain in the upper body, that is arms, back and neck, jaw or stomach, shortness of breath, nausea, and cold sweats can indicate, there can be an indication of the heart attack at this particular point, and may be related to high cholesterol levels. So also we may have things like high with the 12 signs and symptoms for this of these high cholesterol levels. We may have a collective or a part of these symptoms, and high cholesterol often does not present with the obvious symptoms until it has led to more serious conditions like heart attack, stroke, or peripheral artery disease. So regular checkups and blood tests to monitor cholesterol levels are very crucial for early detection and prevention. So adopting a healthy lifestyle, including balanced diet, we have where we have including a balanced diet, regular exercise, avoiding smoking. It can help manage the cholesterol levels to the healthy levels, so that we may avoid developing complications. So what is the way, or what are the mechanisms to manage these symptoms? Managing high cholesterol involves lifestyle changes, dietary modification, and some medications. So I'm going to give comprehensive strategies to manage high cholesterol levels. Number 1 is about dietary changes. So reduce saturated fats by limiting intake of red meat, full fat dairy products, and processed foods. Opt for lean meats, low fat dairy, and plant-based oils. So that's on part 1 of the dietary changes. Number 2 is about eliminate trans fats. Avoid trans fats found in many fried and commercially baked products. Look for partially hydrogenated oils or on ingredients labels. So when you buy those fats or oils, look for those partially hydrogenated oils, because they contain less cholesterol. So increase fiber intake, because consuming more soluble fiber, which can help reduce LDL cholesterol, So foods rich in fiber, including oats, beans, lentils, fruits, and vegetables, are very good in managing or in helping us not to accumulate a lot of it in our body. Another aspect on dietary changes is about eating omega-3 fatty acids. So include fatty fish like salmon, mackerel, and sardines in your diet, and the plant seeds like flax seeds, chia seeds, and also walnuts are also good source or good options for omega-3 fatty acids. Another aspect, incorporate nuts. Almonds, walnuts, and other nuts can improve blood cholesterol levels. Also use healthy oils, replace butter and margarine with healthy oils such as olive oil and canola oil. Number 2, that's the part of the dietary management of this. So another aspect which you can always introduce in managing the cholesterol levels: physical activity, very important. Regular exercise. Aim for at least 150 minutes of moderate intensity exercise like brisk walking or cycling. That are good exercises per week, and also swimming. Exercise help high density lipoprotein or HDL cholesterol and lower the LDL cholesterol. So, and also another aspect on the physical activities about aerobic and strength training, where both types of exercise are beneficial for cardiovascular health and the cholesterol management at that particular point. Also weight management, lose excess weight. Even a modest weight loss of 5 to 10% of your body weight can help improve cholesterol levels. Also maintain healthy weight, achieve and maintain healthy body weight through combination of diet and also exercise. Another aspect, number 4, is about quit smoking. Stop smoking. By quitting smoking, improve the LDL cholesterol levels and the benefit of our heart health. Seek support from healthcare provider or smoking cessation programs if you are addicted to smoking, because this can help you manage the LDL. Limit alcohol intake is also another aspect of management of the cholesterol in our body. So moderate alcohol consumption. So drink alcohol in moderation, up to 1 drink per day for women and up to 2 drinks per day for men. Excess alcohol can raise cholesterol and also triglyceride levels in our body. Another aspect where how you manage this cholesterol is about medications. We have special drugs called statins. These drugs reduce cholesterol by blocking the substance your liver needs to make cholesterol. So also bile acid binding resins. So this medication reduces cholesterol indirectly by binding to bile acids, which prompt the liver to use excess cholesterol to make more bile acids. So cholesterol absorption inhibitors, also the drugs help reduce blood cholesterol by limiting the absorption of dietary cholesterol. And also we have PCSK9 inhibitors. These are newer drugs that can significantly lower LDL cholesterol by helping the liver absorb more of it. Also we have fibrates. This medication in lower triglycerides and also to a lesser extent increasing the HDL cholesterol. So niacin is also another part of this vitamin. It's a kind of vitamin. Niacin, when we talk about this B vitamin, which lower the cholesterol levels and the triglycerides, we widely raising HDL cholesterol, but it's not usually the first choice due to potential side effects at that particular point. So also another aspect on management is about monitoring your cholesterol level. So regular testing, get your cholesterol levels checked at regular as recommended by your healthcare provider. This helps monitor progress and adjust the management as needed. Number 8 is about stress, managing your stress or stress management. By reducing stress, chronic stress can regularly affect cholesterol levels. Practice stress reducing mechanisms such as mindfulness, meditation, yoga, or hobbies that you enjoy. So guys, effective management of cholesterol involves combination of dietary changes, regular physical activity, weight management, smoking cessation, and when necessary, medication can be introduced. So regular monitoring and working closely with the healthcare providers can help maintain the health cholesterol levels and reduce the risk of cardiovascular diseases. By adopting these strategies, you can significantly improve your overall health and also well-being. Unfortunately, with a lot of cholesterol in our body, we have development of complications. And the number one complication which comes about with this, we have what you call atherosclerosis. The atherosclerosis. When we talk about this, we are talking about build-up of cholesterol and other substances on the walls of the arteries. They form what you call plaques, and these plaques can harden and narrow the arteries, reducing the blood flow. And also another complication which can come about is about coronary artery disease. So atherosclerosis is the coronary because of the coronary artery problems. What we call coronary artery disease can cause chest pain, what we call angina, and increase the risk of heart attacks. So with this complication of the coronary artery, we may have heart attacks, which complete with the complete blockage of blood flow, and this can be very damaging, causing damage and death, or also consequently we have stroke coming up as a complication. With the high cholesterol, we have this can lead to atherosclerosis, which can which affect the artery supplying the brain. So this can result in what we call ischemic stroke, and if a blood clot blocks an artery, that's what you develop ischemic stroke. Complications: stroke can cause permanent brain damage and also disability, and unfortunately they cause death. Also, number 4 is about peripheral artery disease, what we call PAD. So atherosclerosis can affect the arteries in the legs, reducing blood flow and causing pain, numbness, and infection. And with PAD, we have severe PAD can lead to tissue damage, or what we call gangrene, and may necessitate amputation. Number 5 complication is about what we call carotid artery disease, which comes about with the cholesterol, high cholesterol levels. So plaque build up in the carotid arteries, the arteries in the neck that supply blood to the brain. A carotid arteries actually supply the upper part of the brain, of the head, and the brain. They supply the brain with the blood, and when they build the plaques build up in the carotid arteries, we have brain being impaired with the supply of blood. So this can cause a lot of problems. This condition increases the risk of stroke at the end of the day. High blood pressure or hypertension is also another complication. So atherosclerosis can contribute to high blood pressure, as narrowing arteries require the heart to pump harder to move blood through them. So on the complications of this high blood pressure, they increase the risk of heart disease, stroke, and also kidney disease. Number 7 is about chronic kidney disease. So because of the reduced blood flow due to atherosclerosis, it can impair the kidney function, and this can lead to chronic kidney disease and ultimately kidney failure if it remains untreated. On the diabetes complications, as also another complication, we have high cholesterol can exacerbate the complications associated with diabetes, such as increased risk of cardiovascular disease, and this can lead to other problems because poor blood circulation and nerve damage associated with diabetes can worsen with high cholesterol levels. Another complication is about metabolic syndrome. With the description, this syndrome is a cluster of conditions including blood pressure, high blood sugar, excess body fat, and also around the waist, and abnormal cholesterol levels. With this metabolic syndrome, they increase the risk of heart disease, stroke, and type 2 diabetes. Also, another complication is also about reduced quality of life, because with the various health issues associated with high cholesterol, they can lead to reduced physical activity, ability, and also overall quality of life. With this, one has chronic pain, increased mobility, and emotional stress can significantly affect how or impact daily living. So high cholesterol levels can lead to very serious and also potential life-threatening complications, primarily related to cardiovascular health, and also regular monitoring and effective management through lifestyle changes and medication. And timely medication can help mitigate these risks. It is very essential to address the cholesterol proactively to maintain the overall health and prevent the complications at the end of the day. So how can we prevent these complications? Preventing high cholesterol and associated complications involves adopting healthy lifestyle and making proactive choices to reduce the risk factors. On the prevention strategies, number one, health diet is very important. Eat balanced diet, emphasize fruits, vegetables, whole grains, lean proteins, and healthy fats to limit saturated fats, trans fats, and all cholesterol, and also added sugars. Also, on a healthy foods or a healthy diet, limit processed food, avoid processed and packaged foods high in unhealthy fats, sodium, and also sugar. So, increase fiber. Choose fiber-rich foods such as fruits, vegetables, whole grain, beans, and also legumes. Also, eat healthy fats. So, include sources of omega-3 acids such as fatty fish, flax seeds, chia seeds, and also walnuts. They are very good omega-3 sources. So, regular physical activity as a preventive measure. Exercise regularly. We said about at least 150 minutes of moderate intensity aerobic exercise, or at least 75 minutes of vigorous intensity exercise per week. So it incorporates strength training, also includes muscle strengthening activities on 2 or 3 days in a week. So stay active, find activities you enjoy, and make physical activity regular part of your routine so that you reduce this cholesterol problem in your body. Also maintain a healthy weight. So achieve or maintaining a healthy weight. Strive for body mass index within the health range of 18.5 to 24.9. So lose excess weight. If overweight or obese, aim of gradual weight loss through a combination of exercise and also diet. Quit smoking is also a preventive measure where stop smoking. Smoking damages blood vessels, increases the LDL cholesterol or bad cholesterol, and raises the risk for heart disease and also stroke. So seek support to quit smoking if you need it. Limit alcohol consumption. Limit alcohol intake up to 1 drink per day for women and up to 2 drinks per day for men. Manage stress. Practice stress management techniques like relaxation. We're talking about meditation, deep breathing, yoga, or Tai Chi to reduce the stress levels. Regular health checkups is also very important. Monitor your cholesterol levels. By getting regular cholesterol screenings and recommended by a healthcare provider, it helps you to check your blood pressure, monitor your blood pressure regularly, and seek medical attention if it keeps elevated. Keep medication compliance is also another aspect for preventing other complications. So take medications as prescribed by your healthcare provider to lower your cholesterol levels. Follow up with the instructions properly and take medication as directed. Health education, stay informed, educate yourself about the risk of high cholesterol and its complications. Understand the importance of preventive measures and lifestyle modifications. Very important, guys. So family history and genetic testing. Know your family history. Be aware of family history of high cholesterol or cardiovascular diseases, so that in some cases genetic testing may identify inherited conditions that may put you at risk for high cholesterol levels. Preventing high cholesterol levels or complications requires proactive approach throughout the lifestyle modification, regular physical activity, health eating habits, smoking cessation, stress management, and medication compliance when necessary. By adopting these preventive measures, individual can reduce the risk of developing high cholesterol and associated cardiovascular disease, ultimately improving health and well-being. So regular communication with the healthcare provider is very important for adherence and also to recommended screenings and treatment is very essential for as a very great component. So preventing high cholesterol and associated complications involves adopting a healthy lifestyle, making proactive choices. This includes maintaining a balanced diet, getting to diet of rich in fruits, vegetables, whole grains, and healthy fats, while limiting the saturated fats. So also avoiding smoking is very crucial. Maintaining optimal cholesterol levels and cardiovascular health is very important by maintaining a healthy weight, regular physical activity, and also avoiding smoking. So monitoring cholesterol level through the regular screening, managing stress, and complying with the prescribed medication are a very important component in the management and the prevention of high cholesterol complications. By incorporating these strategies in your daily life, individual can reduce the risk of developing high cholesterol and lower the likelihood of associated complications such as heart disease, stroke, peripheral artery disease, and also what you call a gangrene, and also amputation at the end of the day. So regular communication with the healthcare provider and awareness of family history can also further support as a preventive measure for high cholesterol management. Guys, welcome to our channel. The channel is Nazvin. Kindly, if you have not subscribed, I want to encourage you to subscribe. We are in a road to 10,000 subscribers. By liking the video, you get YouTube to recommend us to the larger population, so that we get this basic information as a whole. In this channel, we get to discuss matters medical, but in a simple language which everyone understands. Guys, give a nice comment down below, watch the video, and kindly, most of us have not subscribed to the channel. Please, I want to request you to subscribe so that we grow those numbers, and that is the way this information can reach more and more population. By clicking the notification bell, you get to get us when we post a new video. You get that notification so that you get this kind of knowledge, because we have a lot of videos here regarding our health, guys. My name is Vincent, the channel is Nazvin, and I want to welcome you to the next video. Peace, guys. We love you very much. Sedentary lifestyle can predispose one to this problem as a risk factor. So what are the warning signs that one is developing these blood clots?